All right, if you're struggling with ADHD and productivity, you're in the right place. Today we have our special guest, Dr. Diana Mercado-Marmarosh, who is a family physician and ADHD coach. She helps other physicians navigate their way through ADHD and use it as an asset and an advantage. So, without further ado, let's meet Dr. Diana. Hey, doctor, thank you so much for joining us on the MHT Live show. Much appreciated.
I'm so excited to be here with you today.
I'm excited to have you. Such a wonderful work you are doing in the world of neurodiversity and ADHD. And I'm excited to dive in with you, having personal experience and a passion in this field, and to help other physicians and the general public navigate this superpower, but can also sometimes be an out of the box approach. Yeah?
Yes,
All
yes,
right.
I have now shifted my. You always reframe how you see ADHD. I used to think it was probably the worst thing ever. I didn't want anybody to know. Now
Mhm.
I see it as a gift that one has to learn to unwrap.
Oh, I love that. Absolutely. How do we unwrap it is the question, and that's what we're hoping to get from today, right?
Correct.
Excellent. So I know a little bit of your background, as do, let's see here, some of our guests, but just let's go ahead and make sure that we're getting everybody to the right place here. This is your site, right?
Yes.
Your ADHD life coach. This is your jam. For any of those out there wondering where to find you, it's ADHDlifecoach.com. Yes?
Yes. Correct.
All right, we'll make sure we tie up all of that into the show notes. So let's get started. Maybe you could bring us up to speed by letting us know where you're coming from, like where's your home base there, and what got you into this work with ADHD.
Yes. So I am in Victoria, Texas. So it's
Nice.
like 2 hours south of Houston. And I am a primary care physician. I practice in the clinic setting and in the hospital setting and in nursing home setting as well. And my journey into this coaching aspect was one of me trying to find tools for myself. When the pandemic happened, I realized that whatever I was doing, which was ignoring my own ADHD,
Mhm.
was not no longer something that I could continue to do. And I came to realize that lots of my success was also because of my ADHD, my ability to speak up, to say, that's not going to work that way. We did that 20 years ago. The person who's doing that is no longer here. How can we adapt it to now? How can we do it so it's not redundant? So it came from an area of struggle that then became an area of curiosity, wondering if there might be other people like myself who just maybe didn't know what they didn't know. And therefore, it's not that they were on purpose trying to disappoint maybe their colleagues or their spouse or their kids or their friends. They weren't just quote unquote being naughty, but it was a neurological condition that was preventing them from showing up how they wanted to show up. I unfortunately got told when I became an attending. An attending is somebody who has finished their medical school and their residency. I got told by a new psychiatrist that I outgrew my ADHD, that I didn't need any medications, that I should know better given that I was a primary care physician,
Mhm.
that I was kind of wasting his time, and he walked out of the room. So that led to me ignoring myself or my ADHD for 10 years until the pandemic happened. And I really walked around telling myself, suck it up, buttercup. Like, you got this, you got this far. You just got to work harder. That was my running motto. But now I have come to realize that I haven't, I mean, of course, ADHD is a neurological condition. There's low dopamine. Different people are motivated by different things, and therefore you can't put them all on the same thing. What might work for one might not work for the other. But if you're not even aware that this is something that you're not doing on purpose, that you should be able to do it, yet you don't have the capacity to do it, it puts you at a shame blame cycle instead of curiosity, compassion. How can I work with where I'm at to get to where I'm going, even if it looks different from somebody else? If the objective is to see the patient within a certain amount of time and have the note closed, how can I do that for myself without having to do it like the other person is doing right next to me, even though I'm trying 1,000 times like they're doing?
Mm-hmm.
I keep telling people it's like being left-handed in a right-handed world. You don't realize that you're doing 1,000 repetitions with the right, not until somebody says, "Hey, let me use your left hand. Let's use a left-handed desk or a left-handed pencil." You might then just figure it out your way at that point.
So sometimes the unlock is right under our nose. It's just the way we're socialized into how we're, quote, supposed to do things, right?
Exactly.
Can sometimes cloud our judgment a little bit, right?
Yes.
So you had, just out of curiosity, so you had a prior acknowledged diagnosis of ADHD growing up,
I
right?
got diagnosed my first year of medical school, so I was 23 years of
Oh.
age.
So that's hard to be diagnosed as an adult sometimes. I know a lot of times as a therapist, when I'm trying to link adult clients to treatment or testing, it's very difficult sometimes to find a way to get access to that kind of testing without paying out of pocket, sometimes large amounts to get tested and then get it treated, right? Because a lot of times it's the primary doctors will prescribe, but they don't diagnose. And you have to go to a
Yeah.
neuro testing site to do the diagnosis and then get someone else to fill the script. And it's sometimes this dance of the gray space. I think about mental health. Is it behavioral? Is it mental health? And sometimes it's like hot potato, it seems like, in this
Exactly.
provider world. Yeah.
Yes, so I got tested. At that point, I wasn't sure if it was anxiety because I was the first one to go to college, to go to med school, if it was anxiety of wanting to perform and the fear of failure, or if I was kind of depressed and couldn't focus because my dad had just got diagnosed with cancer and he was
Mm.
really young, he was 46, or whether I just had a little bit of mixture of both. The ADHD diagnosis never even crossed my mind because in the Mexican American community, like, you don't talk about ADHD. You're either a spoiled kid who has just not
Yeah.
gotten yourself like motivated enough to do whatever you need to, and they don't or chiflado, which means you're just kind of like acting up, right? And so you're
Hmm.
just energy, too much energy. That's what they would say. So you're right. When you finally get the diagnosis, I think there was still a disconnect between knowing like information about it. Like, okay, they started me on the lowest dose of the medication, but I never knew to advocate for like, okay, I need more than 5 milligrams of Ritalin, right? Because those beautiful 3 hours were like, okay, I can try to do as much as I can, a window of clarity.
You
And I
feel it
didn't
closing
want
the window. Yeah. Yeah.
Exactly. I didn't want them to take away those 3 hours that all of a sudden I
Hmm.
could do so much that I didn't realize I could. And so finally, when I did speak up, and again, maybe it could have been a lack of me not knowing how the medicines worked, or them just assuming because I'm saying it's those few hours are working, they assume few hours. I never clarify. It could be a mixture, right?
Hmm.
And so um, even then, I don't think they told me, hey, go talk to a therapist. Like, you're not broken. You have to just do it a different way. Yes, they told me maybe talk to a tutor or something, but I never really disclosed that I had ADHD because there was a part of me that linked ADHD with inability to perform for some reason, even though now I understand that the reason I studied that much was because it was my passion to be a physician. I would imagine, I would visualize like helping the patients and whatever it took. If it took taking a test that I had to do whatever I had to do, I was going to do all the steps because I didn't know any better. Because being the first one to go through that, I didn't realize people were just studying 20 hours and I was studying 100. Like, I was
Hmm.
going to do whatever I needed to do to get to the end result.
I see. And so you learned a lot of, I guess, I don't know if you want to call them tricks or hustle mentality, in order to make things happen, right? But you didn't realize that you were walking around with 50 pounds of rocks in your backpack,
Exactly.
and everybody else is taking a stroll, right?
Yeah.
Okay. So when you got, what led you to being diagnosed? at 23? Like, what was the
So
motivating factor there?
yeah, so I was taking my test, but it was the first time in my life where, in my mind, the amount of effort I was putting in was not
Mm-hmm.
reflecting the grades that I was spitting out.
Mm-hmm.
And I would run out of time. So, like, if you were to see my test, I maybe got a 60, but you would see that I had completed like two-thirds of the test. And then the rest of the test, C, 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 all the way down.
Mm-hmm.
And so again, I wasn't sure if I was overthinking some things because, oh, it seems too easy. It shouldn't be that easy because I had
Mm-hmm.
studied so much. So I would second guess myself. Or, oh, and yeah, or I would change an answer because again, I would be like, no, it's not that. I mean, you would always, or you would not read it correctly. Like you would not catch that it was an accept question or different things because you kind of got to like quickly trying to get through the stuff. So it was actually one of my roommates saying, Diana, I think you're studying like way more. I think you like you even explained it to me and I understood it and I took the test and I got better and I didn't study that much. Like,
Mm-hmm.
what is going on? Like maybe you should just go get tested just to make sure. And again, I went because of likely she saw something in me that I didn't see. I just thought, well, this is the way it's always been. I've always have worked hard because I just thought that that's what needed to happen. And again, failure was not an option because I wasn't going to walk away with a $200,000 loan that I needed to complete my schooling and whatever it took, I was going to
Mm-hmm.
do. And so I think it was somebody else pointing out, I think there's too much effort that you're exerting for what you're acquiring. Could there be something else? And maybe you are anxious or because of this test. Like maybe you're just panicking about the test. So you can't like slow yourself long enough to read the test correctly, right?
Mm-hmm.
Uh, and so she said, just go see. And that's what led to that neuropsych test, which was like an 8-hour test.
Mm-hmm.
um, and they said I was performing 2 grade levels below where I should have been given college,
Mm-hmm.
but I wasn't worried about that. I was worried about the ADHD diagnosis,
Right, of
and I
course.
was
Yeah.
like, I don't care about that. I still got here. It doesn't matter where I'm performing. I'm still here. And so
Right.
it's funny how your brain like focuses on certain things, and then those thoughts lead you forward or can prevent you from going forth.
Mm-hmm. Absolutely. Yeah. So that was kind of the start of figuring out how to resolve maybe the way you had been doing things. But then what about the next, umpteen years of medical school, the stigma, the managing, because it's not just the studies, right? It's
Right.
managing the clinical, it's managing even after obviously medical school, residency, working with colleagues. Like I imagine that was just kind of step one, pulling back the curtain.
Right. Yeah. So, as people know, with ADHD, you hyper focus on what you find passionate. For
Mm-hmm.
me, again, it was my patient. So,
Mm-hmm.
I would hyper focus during that patient encounter. Like, I could just remember everything and anything that they would tell me,
Mm-hmm.
right? But I also had that time blindness. So I didn't realize I had spent an hour talking to them. To me, it felt like 5 minutes, right? And so when I would go and give a presentation, you could imagine my brain couldn't decipher what was really important to give the details to the attending as a medical
Mm-hmm.
student or a resident. I was like flowing with information because I was so excited about having talked to this patient. But in their eyes, I was all over the place. In their eyes, they were like, okay, Diana, first you have to give me that, like, what is going on? Then what
Concise.
is, like, there's a specific pattern, right? But then your mind would connect something to something else, and they would be like, wait, wait, you're all over. Did you not, like, talk to this patient? And you're like, I did. But, like, ding, 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 all these other things would
Mm-hmm.
connect. And sometimes you would discover diagnosis that they hadn't even thought about because again your brain would link things that you just intuitively knew to ask and you couldn't explain how you got to that place, and therefore it looked like you were just random, like, oh, she just got lucky that she figured that out. because three
Mm-hmm.
other medical students talked to that person and nobody could even elicit that type of information. She just got
Mm-hmm.
lucky. And so my test ended up being, I would do enough to pass the test in the written part of it, but then like my clinical would always be like either all over the place or amazing bedside manner that could compensate for being all over the place. And so with time, I learned that the testing stuff, it didn't matter. Like in my mind, I got the motto C still equals MD. If I just get a C, my patient's not going to care what my grade level was, although
Mm-hmm.
I had never gotten a C in my life. I was always a straight A student. So I had to realize that my C was my A, and that me taking a test and me figuring out to spit out information for you for 1 minute was not going to dictate the hours or the months or the time that I would have with this person to try to figure out what was going on with them really if I could just listen to them.
Absolutely. Well said. I think nobody asks, a medical professional, what their GPA was. They care if you can help them. And there's not a direct correlation. Like you said, that, that's why I refer to ADHD as a superpower. And you would know better than me. It's the ability to deep dive, right? To think outside the box, to have that extra layer of interest and ambition, right? Into
Yeah.
what we're doing. And that translates in all kinds of ways, right? And so standardized tests, are not the best measure of aptitude for
Yeah.
sure.
Yeah, I had
Absolutely.
to learn that there had to be a standard, right? There had to be a
Mm-hmm.
standard nationally to say that you know enough to be able to competently treat a person. But I
Mm-hmm.
also realized that you still had to earn their trust. You
Mm-hmm.
still had to have that relationship with them. And the area of interest that I went into, which is family medicine, I mean, I see 1 day old all the way to like 105 is the oldest I've seen at a nursing home. So you
Mm-hmm.
have that spectrum of being able to understand not just the person, but sometimes when you treat their grandma or their uncle or their aunt, like you get other views that you wouldn't have, other perspectives that you wouldn't have put together had you not understood the dynamics or how to approach something. If maybe again they don't like mental health, maybe I can say, hey, do you know you just have like low hormone? It's like low serotonin. And they're like, oh, well, what do you do about that? So
Mm-hmm.
that's a lot different in reading people. And and I maybe because I was a high school teacher prior to becoming a physician, that also taught me to think and teach other people and connect with different people. Some people like visual stuff. Some people like reading my lips. Some people like reading or looking at pictures, or some people like listening. So I had to learn how can I use different perspectives of how I taught others to teach myself to be able to grasp whatever I need to in order to get to where I needed to. And so I ended up, instead of going to the class, I would go around Rice, the university, and run and walk and hear the audio
Mm-hmm.
version because I knew if I went to the class, I would be talking to my classmates instead of listening. So I just had to find a way to still ingest the information, but in a way that, and I didn't know at that point that by exercising, I was increasing my dopamine and I was increasing my ability to pay attention. I was priming my brain. I didn't realize that. And by seeking a tutor, I didn't realize that because I didn't want to look like a dummy. I would study everything I could without realizing what was the key points. But then they would tell me
Mm-hmm.
what the key points were
Mm-hmm.
because they had taken the test and they understood. And so it would help me again to chunk down, okay, this is a topic I need to know. This is a topic I need to, instead of me trying to memorize the whole book, so to say.
Oh, that's very savvy, right? We know we all learn different ways. Some are kinetic, some are audio, some are visual, right? Um, I'm definitely an audio and visual guy. I'm kind of like, I want to see it, and then I digest most of my books by audiobooks. I'm a podcast addict. I always have an AirPod in my ear, and that's just my jam. And yeah, it's convenient when you're doing laundry or mowing the lawn, but more so like I absorb information differently by
Yeah.
audio. Maybe that's because of it, that's my trade, in counseling. I've worked that muscle a lot. But you give me a book, I'm probably gonna fall asleep.
Yeah, exactly. So I learned to use books in a way to prime myself by looking at the pictures first. So I would ask myself, well, I wonder what this is trying to explain. Like what muscle works where? Like I would ask myself the questions before I would try to read the stuff or I would try to listen to the stuff. So I would make it a game to try to understand or piece together stuff. And then I would try to draw stuff in a one single page so that if they were on this side of the page, then I knew these all were alike. If they were on this side of the page, they were different. So if I was taking a multiple test question, I would know, okay, they were on this side of the page. So all these are negative. So these might be, I'm down to 2 instead of 5, right? So I learned
Mhm.
to take tests by, if I didn't trust if it came too quickly, I learned to figure out, okay, how can I still arrive to the information in one way or the other based on how I studied it. And of course, you would get out of the test and then 2 minutes later everything comes and you're like,
Of
give me
course,
that
right.
back, right? But you're in the
In
moment
there.
where
Yeah.
you're just like, oh, you know?
Yeah. Trying to connect that thread. Absolutely. And so these are skills that you continue to practice. You probably used prior to medical school up to that point. These were some of the tricks of the trade, right? And learning how to work, with the current as opposed to swimming against it, right? With your thought process, the way you learn, and maybe you didn't classify it as ADHD prior to that. You still found ways to make it work, right?
Yeah.
And obviously the medication probably helped you do that better, right? With the concentration. So you're going through medical school. You're using these tricks that you've learned. You start the medication. Did things get easier after you started the medication?
Yes, the medication definitely helped a lot. But again, now looking back, I can see why it also helped because I was running. When
Mm,
the period when I wasn't running, it wasn't helping as much. When I
mm,
would start to run or do some type of exercise, it would enhance the medication. And probably in high school and in college, I didn't get diagnosed because I was always running. Like in high school, I was in a cross country team, and
mm.
sometimes I would run up to 10 miles a day. So that was my medication, and so I'm very conscious of that now because many times when patients come to me, it's sometimes when they are trying to quit smoking or alcohol, or they just had a surgery because of something and they're not exercising, their memory starts to fade, or if they just got diagnosed with diabetes, they might not be aware that they're using sugar as a way to try to
Mm.
cope. And so now I'm very mindful of that. When they come, if they're coming for anxiety or depression, I screen them for anxiety, depression, and ADHD. Or if they're coming for concentration, I still screen them for all three. Whatever they're coming for, and even if they're postmenopausal, because sometimes females don't get diagnosed until they're menopause. So
Mm.
yeah, so I think my own personal struggles and what I see in my patients has allowed me to it's like they say, it's not that you can't concentrate. Sometimes we concentrate on too much at once, and then you have to figure out, okay, let me not be listening to the other conversation in the other room. Let me focus on this conversation. Or if I am going to use music, can I use it without words so that I don't get distracted in the words? And so you just learn to figure out things for yourself to get
That's
to
a
the
really
next
great
goal.
analogy. I haven't heard it put quite that way before, but I get it. Like when you're trying to chase 10 rabbits, you end up catching none. But the way you said it, like focus on the conversation in this room as opposed to trying to eavesdrop on everything else in terms of where your thoughts are going, right? Which are all productive things, like you said, but it's the ability to maybe hone in on one thing without becoming preoccupied or anxious about the things that maybe you're going to forget or not attend to, which we see with all forms of anxiety. And I think this is of particular importance for people who are trying to get diagnosed. I know when I've had clients who are trying to get it diagnosed as adults who have a co-occurring or pre-existing anxiety disorder, sometimes they say, well, we can't really do the testing because your anxiety is at such and such level. It wouldn't be really a clear indication. And so that the water is a little muddy. But it sounds like even with ADHD, that's kind of part of the bag too, right?
Yeah.
Is organizing your thoughts,
Yeah,
focus.
and the thing with ADHD, the way I see it is maybe. it could also be to your benefit because, again, if you're used to juggling so many things at once
Mm-hmm.
that I feel like we play whack-a-mole all day. And
Right.
because you're used to playing whack-a-mole all day, if you don't begin your day with the intention, okay, what is my intention today? Is my intention to be on time? Is my intention to close my notes? My intention
Mm-hmm.
to get out so I can see my kid's soccer game? Like, what
Mm-hmm.
is my intention today? And can somebody help me to get there? So with me, I had to set out timers outside of the room so that somebody would come and knock and say, hey, Dr. Mercado, do you need anything? That was my cue to be like, oh, yes, I need a tetanus vaccine or I need this medication sample or whatever.
Hmm.
So instead of them coming and saying, hey, the ER is calling, which sometimes they did, or this or that to try to get me out, I used it as a cue to be able to help me. Okay, I should have been ordering labs, or I should have been doing my physical exam at this point, or whatever. And it was a way, instead of shaming myself for not being on time, it was a way of saying, okay, I should be on time like everybody says, but I just don't have that awareness. So instead of shooting myself, can I just acknowledge that I don't have that awareness? How can I help myself?
Mm-hmm.
How can somebody help me to be able to now obtain that awareness? And for some people, maybe that's distracting to come and knock on the door. So maybe they want to set up a watch that like dings, and so you know. Or maybe they want to have a visual timer where they can visually see when it's going to 5 minutes because you
Mm-hmm.
can't tell what 10 minutes looks like. And so it really has to become a personal thing. But if you don't pay attention again to yourself, what is your perspective? Like, um, if we wait to be motivated, we're never going to feel motivated sometimes, right?
Right.
But if you find a way to reward yourself, so I learned to start printing out like how many, like the thing of the patients I was going to see. And every time I closed my note, I would scratch it out. So it was a quick dopamine hit. Okay, I'm done. I'm done. I'm done. And so it was a way for me to visually see where I was and how I was moving through the room and how, or through the day, and how it, maybe I should speed up or slow down, or how many people were double booked. And I took that away. I was like, I don't need to be double booked because there's no way possible I could be in two places at once. As much as I want to believe I cannot. And if a person needed me to be on time, um, they either had to be my first patient of the day or my first patient in the afternoon. And if that's all they cared about, like I wasn't gonna be their patient, I wasn't gonna be their doctor. I am
Mm-hmm.
the person who's gonna hear you and I'm gonna figure out what's wrong. And that might take 1 minute, that may take 45 minutes. I have no idea. Of
Mm-hmm.
course, I'm gonna be mindful because I know that if you're the one waiting for me, you're gonna be like, where is she?
Mm-hmm.
But I had to learn that the timer was my best friend. That if I, and even doing this for 3 years now, if the day I don't set my timer, it's not like, oh, okay, she has a muscle that she can just train. No, I will not be on time because I am relying on that timer.
Wonderful strategies. So, when it comes to managing ADHD in the professional environment as a physician, you've learned some of these parameters, cues, boundaries with yourself, but it also sounds like they're value based.
Yeah.
Like you said, you want to be able to give your undivided attention with your patients and make sure that you're not double dipping on your time, not double booking, which I know, is a big ask in the medical field. I mean, doctors are the busiest people on the planet.
Yeah.
Um, and trying to manage your calendar that way. I'm sure it wasn't easy setting those things up. And was it like a trial and error process?
Yeah, it was a trial and error process because, of course, most people, and I'm generalizing, most people with ADHD do not want to say no to things. Anytime you ask us, we always say yes. Of course, I'll
Oh.
take care of it. I'll do it.
Mm-hmm.
And so it was learning that I literally had to tell myself I am the most important patient in the room. If
Mm-hmm.
if I'm not taking care of me, if I'm not doing this for me, I am only going to show up 20% for this person. Even though I pretend I'm giving them 120, I'm not, because I am not optimizing my way of doing things. So it really had to be a shift of me missing my own two ADHD
Mhm.
private sessions that I paid for
Mhm.
when I realized that I kept thinking they're not respecting my time. But my husband was like, they're not respecting your time, or you're not respecting your time. And I
Hmm.
was like, well, what do you mean? They're like, did somebody put a gun to your head to walk into that patient's room? And I was like, well, no, it's my duty. And he's like, whose duty is it first, to yourself or to the patient? And I was
Hmm.
like, well, to the patient. They're like, and my husband's like, really? And so it really had to be that conversation of understanding that yes, of course, it's my duty to my patient. But again, if I don't help myself first, if I'm not showing up in my gifts, in my strengths, in my passion, I'm going to show up like burned out. I'm going to show up mad
Hmm.
or frustrated that I haven't eaten anything or that, and then my nurses would have been like, is she mad or is she happy? Can I put a one or can I not? Like they're trying to read when if you just make the decision ahead of time, then you don't have to worry. You just change your schedule to have some acute slot somewhere where then you can put those patients in there because you purposely have told them, I do want to take care of them. It's
Hmm.
just that I work best in the morning. So put all my chronic in the top and I am kind of burned out at the evening. Let's put some acute in the bottom. And so
Ah.
again, it's shifting it for each person, right?
Hmm.
And I created a 12-week physician coaching group and healthcare provider group
It's
that is
fantastic.
actually for CME so they can get continuing medical education. And you would think that most physicians or healthcare people that are have ADHD are just ER docs, but we're everywhere. We are pathologists, surgeons, pediatricians,
Right.
psychiatrists, radiologists, OBGYNs, like you name it. We're everywhere because again, if you're aligned by your passion, you're gonna
Hmm.
follow it regardless.
Hmm.
And at the end of the day, it's always the mundane stuff, the administrative stuff that get can seem to get us into trouble. So if you find a way to set it to your tendencies, if you're somebody who is better in the afternoon, then put your shift to be 10 a.m. to 7 or whatever, right? Like
Hmm.
so that you can go exercise in the morning or you can go take your kids to school or you can work part-time. Like stop trying to see what your colleague is doing and focus on what you want to be doing, right? Because again, if you show up happy with what you're doing, like then it's a win-win for the patients and for your family because then you're still doing it from a point of passion instead of from just a job perspective, I think.
You just touched on something that I was curious about because it's one thing to know how to manage your agenda, your to be productive in the workplace in general. I mean, you put ADHD as an extra layer on top of that, it even complicates things more. But then there's the self-care aspect, which you just touched on, right? So it sounds to me like what you're saying is not only is it important to know when we're at our best, to know ourselves, right? Have that insight and then plan our anticipated workload around that and work smarter that way, not harder. But also to make sure that we're factoring in that self-care. Like you said, to show up as our best self, to have our cup full so that we can serve others. And so it sounds like that might even mean like, okay, you still have to choose where your energy goes. Because if you're at your best in the afternoon, that doesn't necessarily mean you go to the gym in the afternoon. Sometimes that means choosing. Do I want to be my best? Do I want to feel my best at the gym or do I want to feel my best at work? Right? It's a
Exactly.
conflict.
Yeah. And again, that's where, and I honestly, I didn't even know what self care meant. That
Mm-hmm.
sounds silly. But to me, self care maybe meant like getting your nails done or whatever. And I never had time for that. So I
Mm-hmm.
was like, whatever. But I realized that self care meant eating, meant going to the bathroom, meant sleeping,
Mm-hmm.
meant showing up for your kids if you wanted to show up for their teacher parent conference. Like I realized that self-care meant the basic things that are so common to everybody else that maybe doesn't have ADHD because their brain just kind of tells them, yeah, you should sleep about 7 hours. Yeah, maybe
Mm.
you should have a little bit more protein instead of all sugar. Uh,
Uh-huh.
and so I realized that if I wasn't on purpose practicing self care, which was setting the intention for the day, what three things am I grateful? meditating, if I didn't come from that perspective and judge myself for being tired and da 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 da,
Hmm.
then I was in self neglect. And self neglect did not help anybody around. And and again, like I realized that, okay, why do I give everything to my work family? And then I am
Mm.
depleted. I have zero executive function for my real family at home. I say everything I'm doing is for them, but I don't have enough energy to give them because I'm just depleted because I stayed too much in my passion at work and did not have that reserve. And so, not until COVID, then I found life coaching, and then I found ADHD coaching, and I was glad that the physician coach was honest enough to be like, Diana, you're still all over the place. You might still want to consider medications. They might work or they might not. You're running, you're doing this, you're doing that, but I don't still think you're optimized. And it might, maybe you are. And so why don't you give yourself a chance to seek a therapist or seek a counselor or seek a psychiatrist? Like,
Hmm.
what would you tell your patient if they came to you? And I was like, well, of course I would refer them. And they're like, well, why can't you refer them to who you would trust to refer them to? Why can't you refer yourself to somebody you would trust? And I'm glad that again somebody gave me the permission that we don't give ourselves, which is to seek a second, third, fourth, fifth opinion. If something is not working, like just ask. Maybe it is ideal and that's perfect. Great. They all confirm that this is your max, right?
Right.
But if it's not, why allow a stranger who gave me less than 2 minutes of their time when I became an attending to tell me that I should outgrow this? Like, he doesn't know
Mm.
what I've been through. And
Right.
of course, if I could go back now, I would tell him that. But maybe I had to go through all this to be able to advocate for myself and for those around us. And again, to realize that I wasn't trying to be lazy. If anything, most people with ADHD are way overworking themselves. They're the opposite of lazy, but they're so spent that then you just see them when they're burned out. You then label them as lazy because you don't know how much it took to get to that.
Wow. Absolutely. And so you took something that could have been taking you off course, right? That kind of negative feedback kind of sounds pretty like it sounded like a permanent thing. Like, oh, you should just forget about this. And this is somebody that you went to seek help from, and you could have just left it there. But instead, you said, "Oh no, I'm going to get some other opinions," and that's very smart. And I'm glad to hear you advocating for that as a physician for people to shop, get other opinions, shop around, get a consensus, right? Because we're all human. Everybody
Right.
has their implicit bias. Everybody has their niche and mental blocks, and nobody's an expert in everything.
Right.
So it's important that we try and look for that aggregate of information, that knowledge, and then make informed decisions. And I'm so glad that you did, and you're such an advocate for others because of it, right? And because you received coaching, because you invested in yourself, now you understand the power, right, to provide that space for others.
Yeah.
Yeah.
Yeah. And I think that's another, you don't realize that sometimes, again, this, our self-talk is so crucial, and we don't realize
Hmm.
that we're not all our thoughts, we're not all our emotions, and that there's some good in there that you need to really like write down, look at every day. And there's some that, just like at home, you have to take out the trash. Like sometimes you have to take out the trash, whatever your brain is offering. You
Mm.
need to put them down and keep going. And but asking for help is the first key, because many of us have been told or maybe grew up thinking, oh, I can just do it myself. I should be able to do it myself. And it's silly for us to think that we're supposed to be like the lawyer for our kids, the nurse for our kids, the doctor
Mm.
for our kids, the accountant for our kids, the teacher for the kid, like everything for your kid, right? And
Hmm.
Disney for your kid, right? You're supposed to provide all kinds of
Right?
entertainment too, right?
Yes. Yes.
And so I think you have to realize that back in the day, like it was because of communities that people did so well. Like they could go to
Hmm.
church, or they could go. have like, go to their auntie or uncle or whoever to try to figure out what piece that person needed in order to further fulfill themselves, right? So maybe dad's not happy. Well, it's not that he's not happy, he's tired, he's working 2 or 3 jobs, right? And so
Mm-hmm.
instead of who else can help me or how else can I reframe this so that you use all the tools, the therapist, the counselor, the ADHD coach. And maybe sometimes investing in couples therapy, if you have somebody who has ADHD, is the single best investment you can do, because sometimes what brings you together, it's what tears you apart, because you're like, oh, you used to be so like creative and innovative, and but now then you continue doing that and they're like, you're childish, you haven't done da 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 da. And so you don't realize that sometimes how we show up in one aspect, we show up in all the aspects. Maybe we're trying to people please because we don't want to let anybody down, and we say yes to commitments that we shouldn't be saying yes to, or
Mm-hmm.
and sometimes that could be money commitments, or that could be time commitments, or and we don't realize that the things you say yes to means you're saying no to something else that you might have really wanted to do. And it could be that no right now. It might be that in two or
Mm-hmm.
3 years you decide yes later, if that's still valid.
I'm so glad you bring that up because we talk so much about this in counseling as a therapist. This idea of learning how to communicate your boundaries and protecting time for yourself is not selfish, right? When we fill our cup. I think so many people struggle with being people pleasers, having trouble with no, and learning just that language, right? Like you said, maybe not right now, or if somebody asks for your help, saying like, I would love to do that for you. I'm not in a position, but here are some resources. Other ways to communicate, ways you can help, or not a no right now in order to protect that time for yourself and fill your cup. And that's something I wasn't even aware of, is that people with ADHD tend to have trouble with that. That like to say yes to everything. Where do you think that comes from?
Well, if you can think back, like again, people were living in tribes, right? And if you were not pulling your weight, then you might have been kicked out of that tribe. And being kicked
Mm-hmm.
out of that tribe meant you might die. Like you don't have
Mm-hmm.
anybody who is having your back to survive, right?
Right.
And so we have something called rejection sensitivity dysphoria, which means that if if you tell me no for some reason, and it might be an insignificant little thing, but we take it to mean like 10 times like what it is. Like we feel like you really rejected us. Like we feel like you left us, like, I don't know, out on the road, and people are like, pointing fingers and laughing at us. That doesn't really, it's not true, but in your
Mm-hmm.
brain, because of that innate wiring of wanting to fit in, wanting that love and acceptance, if we are saying no to something, we automatically think you're going to reject me. And if you're rejecting me, you're rejecting my whole family. And that's it. Like,
Right.
and
Right.
so
It's bigger
again,
than life. Yeah.
yeah. And that's why sometimes when we do become overwhelmed with trying to do too many things at once, again, it's not that you have a problem. It's just you're trying to do too many things at once. Like, slow down, breathe. Again, what is my intention here? What am I
Mm-hmm.
trying to do? What? Why am I nervous? Like, what is happening right now? Am I really like in danger? No, I'm not. I just think I am, but I'm not really in danger, right? And so it's that, like you said, ability to look at yourself and feel those vibrations in your body. That they're just vibrations, but we sometimes have not been taught to label them: anger,
Mm-hmm.
sadness, frustration, resentment, because in our mind, we should not be feeling sadness or anger or whatever. We should just do it because that's what a mom would do, or that's what a husband would do, or that's what a doctor would do, or that's what the boss would do, or whatever, right? So we should again, and it's all these expectations that are unmet that
Mm-hmm.
leads to that feeling that if I tell you no, you're gonna reject me, and therefore I'm gonna feel horrible. And I mean, it got to the point where I had to realize that sometimes I was lying again because I didn't want to say, no, I cannot come to your party, I'm so tired. I would say, "Oh, I'm on call." And then, of
Mm-hmm.
course, they would ask me, "How was call?" And then I forgot I had told them I was on call. I was like, "No, I wasn't on call. I was asleep. I was tired all week." And so
Right.
then they would be like,
Yeah.
"But you told me." I was like, "Oh." And then so then all of a sudden you look like a liar when,
Mm-hmm.
I mean, you can't even remember, right? Who you're telling what to. But instead of just saying, "No, thank you for the invite, but this week I'm really spent or I'm really tired. I'm gonna rest." Or you don't even have to say why. You can just say, "No, I'm not available." And that's it,
Right.
right? But
Right.
then you get yourself in trouble when you do over explain. And then
Mm-hmm.
maybe it was, again, you're trying not to hurt their feelings and
Mm-hmm.
you end up looking like a dummy when they
That,
find out
that
that,
kind of goes back to what you're talking about with the whole like case presentations and things. It's sometimes TMI and going off on like side journeys with your discussion as opposed to focusing on just the necessary information.
yeah,
And so that can not only create angst in the workplace, that can create angst in your relationships too. And it's kind of like this negative feedback loop, right?
exactly.
Then you have that self-fulfilling prophecy
Yeah.
somewhat.
So I had
Yeah.
to learn that I literally had to write a one page of what happened today, not one chapter, not one book of what happened today.
Yeah.
Like
I
I
like that.
have to tell myself,
Right.
no, this is like just today, like what happened today. We discussed this medication, this medication, this medication. I don't need to go back to 20 years worth of stuff that is not relevant to right now. And be happy enough that if I needed that information, I would know where to go hunt for, so
Right.
that I wouldn't be again carrying extra um, memory stuff that I was keeping in the front of my brain that
Mm-hmm.
was not important. And so one of the key things I did was I told myself, I'm gonna gift myself 3 minutes before I walk out of the room to write my assessment and plan. I already did the hard part. I already know what we're doing. I'm gonna know it the best as I can right now. I'm not gonna know it at the end of the day when I've seen 20 Garcias or 20 Smiths. I'm not
Right.
gonna
Right.
remember it. I'm not meant to have a my short-term memory is always going to be 1,000 times better than my long-term memory.
Mm-hmm.
And so it might take me 3 minutes now. It might take me 15 minutes at the end of the day. It might take me 2 hours trying to piece it together in 2 weeks from now when I didn't know what happened.
Right.
And so I had to learn that my messy first draft was going to be actually amazing because people could know what happened.
Mm-hmm.
And I wasn't overthinking it. I just said exactly what happened. If it was control, not control. If I changed or I didn't change because the patient was not even taking the meds or we're restarting the meds. And so I had to learn to get to the point so that when I would read my own note, it would take me less than 20 seconds to read my assessment and plan. Because let's be real, 90% of the notes never get opened again by anybody.
Isn't that the truth? Yeah.
And
Even
are
in
you really
counseling, I
going
had
to
to
sit
learn that. I
there
was
for
like,
40
okay,
minutes trying to read? No,
just
you're
doing
just going
progress
to,
notes as a therapist. I was like, yeah, remember when I first started out, it was like a book, for a progress note. And like now, fast forward 12 years, it's like a few bullet points. Like, okay, this is what we addressed.
yeah,
So when I look back, I know it's important, right?
yeah,
So,
exactly. And knowing the key things, like you can say, house burned down, right? Like you don't have to go into the how
right.
many people were in the
Yeah,
house, what time was it in the day, was it in the spring, was it in the fall? Like, no, right?
that's so true. I'm sure we all appreciate that validation. I know I do, for sure. So, so much wonderful information, Dr. Diana. Before we land the plane, I'm wondering if we could do a few rapid fire questions. Things that I think would be appropriate for anyone watching the replay on this. So, one of the things I hear the most complaints about with people with ADHD is productivity, right? How does one stay productive on a task, whether that's studying for an exam or getting through their to-do list? How do you prioritize tasks and manage time effectively in light of ADHD symptoms? Or what advice, as a coach, would you say is crucial?
So I would say if it's something that you are trying to set up your systems that you do all the time, first just get curious. Time yourself. Ask yourself how much time do you think this takes? Then time yourself. Like without modifying, changing anything, gather awareness, right? And then ask yourself, what went well during that thing? Like, where was the areas where I felt in flow?
Mm,
And then what were the distractions?
mm,
Like, what got in the way? Like for me, when I was trying to do the charting or when I was trying to finish my encounter, I realized that I had to stop disruptions. Nurses would come and knock on the door and be like, "Hey, could you sign this order?" Had nothing to do with the patient I was seeing. "Hey, the ER is calling." Blah, blah, blah. Of course, I can call them 2 minutes after I walked out. Like, so
mm-hmm.
I had to get very clear with what was. Oh, I was constantly running out. So why
Mm-hmm.
don't I have a binder with the common things that I always give my patients? This is for blood pressure. This is for this. Why do I have to keep printing it over and over and over again and running out to go get it and then come back in
Right.
for them to
Smart.
then tell you five other questions that you thought you had finished the encounter? So, productivity, see what you're already doing because everything is a system. We live and die by our habits. And
Mm,
even the bad habits or inefficient habits are there for a purpose because they are still accomplishing something. If you're somebody like me who at 2 or 3 was going to go get the cookie because I needed some fuel to get me through the rest of the day, then realize, okay, at 2 or 3, let me do like a 3 minute meditation instead of the cookie, or let me put in a gum to get some oxygen to my brain to think more. So, like, again, to be efficient or effective, you have to realize that you already have some habits and why are they going well? And maybe set up
mm-hmm.
the environment. So, for me, I have to set up a candle. I always have candles.
Ah, love it.
Boy, they smell nice.
Mm-hmm.
They help me be in flow. It's like I was rewarding myself for doing a task that I didn't want to do. I love my patients. I felt like I already did the work in the room. Why do I have to write this note? But if I set up a candle that relaxed me, that grounded me, and I started with the intention is for me to get these notes done as quickly as possible with my short term memory, right?
Absolutely.
That was my intention. My intention was not to sit here with this note for 8 hours, although there was a period in my time where I did do that, that I didn't realize that working fast and not necessarily working for accuracy, but fast didn't equate to working slow and taking 20 hours. Like I could always go back and modify stuff, but if I
Yeah.
got my points out, it was so much easier to modify than to sit there and create a perfect draft that never got done, right? So I think when we're talking about productivity, make it a game, make it
Ah,
playful, beat the timer. If you don't like timers, beat the song. Put your favorite 2 or 3 songs that you like, and you can say, I can do anything to this 2 or 3 songs. And even if you cannot, quote unquote, complete the task, sometimes we all know initiation, task initiation, that's an executive function.
absolutely.
That's different from task switching and task completion. So do not try to lump all 3 tasks into one. They're different. So don't blame yourself for, look at me, I started 10 tasks and I can't complete. Well, you're very good task initiation. That's awesome. Okay. So when can you restart that task? Can
Mm-hmm.
you put it later on in the day? Can you do it tomorrow? Can Sometimes you just have to put it on your calendar. And
Ah,
the more bite-sized they are, the easier it is for you to accomplish what you want. And then
isn't that the
sometimes you
truth?
have to be real. You're never
We
going
like
to
to,
do it, even if it's in your calendar.
right?
Who can
Yeah.
you delegate that task to? Do you have a
Mm,
best friend that this is like their jam and they'll take him 2 minutes? Maybe, right? Why not use the village? Do the buddy doubling. Like they might be doing their own thing, you're doing your own thing, but it's that accountability that I have told you out loud what my objective is for today. My objective is to do yoga. My objective is to do these dishes. Okay, can I put on a podcast like you said? Can I hear Shakira? Because I'm gonna do something fun with something not so fun. And if it takes me doing the dishes 3 times in the dishwasher because that's how much energy I have, it is what it is. Don't judge yourself. That's what you got. That's what you do.
I love that approach. You just hit on so many hot topics that are really salient across personal development, and this idea of time management is so closely tied to our idea of the self, our ego, our self-esteem, our sense of capability, right? Adequacy in the world, so much, right? To ourselves, to others, our value, right? How we perceive value, how we feel like we're valued. It's just such a huge topic, and you just hit on some of the most crucial aspects, right? Time auditing. How often do we take time to audit where our time is going so we can better manage it, right? So we can improve our systems. So important, like you said, with the binder, right? I've been telling myself that for the last couple of weeks since we got back from the pandemic. Prior to the pandemic, I used to print out a lot of my handouts for clients and worksheets and stuff I would use repetitively, right? The homework assignments and stuff, and I would keep them in folders in my portfolio and I would hand them out. But since the pandemic, I had stopped doing that because we were all virtual for so long. And now I'm seeing people in person again. I'm like, oh, yeah, that's why I did that. I forgot I should do that again because I find myself doing like all of those mini steps, and that adds up, and it breaks up the flow for sure. So improving the systems, doing time audits, finding out where the time sucks are, the distractions, as well as improving the moment. Right, we talk about that a lot. If there's an unpleasant task, how do we make it more pleasurable? I know what I do is I'll if I need to focus doing my charting, whatever, I'll put on Lo-Fi Girl, Apple Music. It's like lo-fi beats. Great. It works great for me, and that's my go-to. If I press play on my keyboard right now, it'll start playing. It's always in the background.
Yeah.
Things like that, right? It puts us in the zone, like you said, with the candle, right? That aromatherapy, right? That's improving the moment. And you said start simple with drafts and gamify it. I love games. I think that's one of the most powerful tools across the board with personal development, even in marketing and pretty much everything. We're talking about human behavior, psychology of behavior. If we can gamify it, then we're more engaged, right? It's
It,
less like work.
and use it to your strength. If you
Mm-hmm.
know that you've been putting off stuff because you have a cluttered stuff there, go to the Starbucks. Go to like the library. Go some. If you need to go and check into a hotel the week before you take a big test, go do that. Like, do whatever it takes for you to have your sanity, for it to feel like a gift to yourself
Mm.
instead of like a, oh, I should have really put all those papers away. Like, it's in the background, right? It's like
Right.
you're shaming yourself instead of being in this thing that I said my intention was, it's in the background. So if it's distracting you, out of sight, like put it in the other room, put it in the closet, lock it, whatever. Like, you just gotta decide what is the most important thing right now. And I always tell myself, right here, right now, right here, right now, I'm talking to you, right here, right
That's right.
now, I am shopping, right here, right now, I am reacting with my
Right.
kid that is having a meltdown, and I am breathing through this so that I don't react back. So like you have
Right.
to like realize right here, right now, like you can only do one thing at a time. Even though we all try to pretend that we can do 10,000 things, we can't. So if you
No.
just go back to what am I doing right here, right now, and why, right? Why? Because somebody told me, or because this is what I want to do, or because
Right.
I need to get paid for this chart has to be closed, right? Like why?
Yeah.
Why? Because the why is what's going to drive us to complete the task that we're trying to do.
Wow, man, those are all excellent, on point. I mean, fire tips, 100%. Uh, and this is again just the work of personal development and being, like you said, mindful, being present, right? Being committed to where we are. And sometimes that actually I should say sometimes that always requires that we get good at catching our thoughts or catching our behavior when we find ourselves being distracted. And that's easier said than done. Sometimes it's
In knowing
an
that again,
exercise.
the role here is not perfection. We're
Hmm.
talking about progress, right? Because do I still jump sometimes at what my husband says, and then I'm like, and then I have to call him back and be like, I am sorry, that came out really wrong. I think I attacked you. I didn't even hear your side. And
Hmm.
again, being willing to reflect that just because we've been doing sometimes some patterns on automatic, it doesn't mean that you can't still like save grace, right? And have compassion for yourself. If your friend called you and said, this is what just happened, what would you tell her or him, right?
Hmm.
And being, strong enough to be like, I'm sorry, I didn't show up how I wanted to. This is what I was thinking. And maybe that's not where you were going with that, but that's where my brain went.
Hmm. Wow. insight. So many nuggets of wisdom here, Dr. Diana. I really appreciate you being on the show. I'd love to have you back on to share more about this topic. It's deep and wide. Yeah?
Yes, yes,
And
it's a
you're
spectrum for sure.
it is 100%. And I really appreciate your input. I think we lost our Instagram stream, but that's okay. Anybody who wants to catch this replay, just head over to the YouTube channel or the Facebook page. It's up there. It'll be live as soon as we have the broadcast here, okay? And as far as where everyone can find you, we know about ADHDlifecoach.com. Is that hyphenated?
Yes, it's hyphenated. ADHD-lifecoach.com. There's an area there where it says connect. So you can just send me a message through there. I also have a podcast that is called Beyond ADHD, A Physician's Perspective.
Oh, how
And
fantastic.
I will have you there as a guest soon. So
Oh,
people
I would love,
come,
yeah, I'm looking
you
forward to it. That'll
come
be great.
and see.
Yeah.
And that's the beautiful thing about that name for that podcast, because it could be my perspective on anything and everything. Yes, it could be ADHD related, but at the end of the day, we're all just trying to do the best that we can with the tools that we currently have available, right?
Oh, isn't that the truth? We're all just doing the best we can with what we have, with where we are, and staying scrappy and not shitting on ourselves or shaming ourselves along the way, right? Just trying to keep an open mind and work with the systems, improve systems, right?
Yeah.
So much appreciated, Dr. Diana. As always, you're appreciated, and you're welcome back on to share more nuggets of wisdom at your leisure. So thank you.
Thank you so much.
All right, you take care.